Yeah, so the ABLE-41 study is going to be an important study. This is a real-world, multi-center observational cohort. It's a non-interventional trial, basically. It's a registry of sorts. So we're going to see the real-world use and outcomes of Nadofaragene firadenovec. It's going to target about 50 sites across the U.S. We're hoping to accrue about 200 patients. And basically, we're going to be looking at the real-world use and outcomes of the drug. So both from a patient perspective as well as a provider perspective. These are any patients who are going to be receiving Nadofaragene firadenovec as part of their treatment algorithm. And there are very few exclusionary criteria, basically anyone who has had it before or is currently involved in a trial. Otherwise, anyone who's going to be on it at the discretion of the physician will be able to enroll into the registry. So the ABLE-41 will register patients and will follow, and we're looking for complete response rates, much like a clinical trial at any time, and again at 1 year, with secondary outcomes of the usual recurrence-free survival, cystectomy-free survival, the side effect profile. And one of the other important features of this trial is the surveys that are going to be done for both providers as well as the patients and their family or staff, whoever's taking care of the patients. So these are surveys given at before the treatment and at every visit for the patient, and then for the treating physician, usually about 1 month after and about a year after. So we're going to get a good sense of how this drug is not only being used all around the country, but also what the efficacy is and what the outcomes are in a real-world setting.